In a completely disgusting move, Arkansas has become the first state to ban access to gender-affirming care for transgender minors, including reversible puberty blockers and hormones. So first, more on this from Yahoo News. HB 1570, the Save Adolescents from Experimentation SAFE Act, just a ridiculous name, prohibits trans youth from accessing health care and insurance coverage for gender-affirming care. The bill passed 28-7 in the state Senate. The state House passed the bill earlier this month. The bill would prohibit doctors from offering gender-confirming hormone treatment or surgery to trans minors. Doctors would also be unable to refer minors to other providers for treatment. The legislation now goes to Republican Governor Asa Hutchinson's desk for signature. He has not publicly said whether he supports the legislation. The governor has 5 days, not including Sunday, to sign or veto the bill before it becomes law. If signed, the bill will become the first in the nation to target trans health care. It would take effect this summer. So I kept looking for updates on this. By the time this segment is cut out of the stream, this may already be signed. But we can, I think, safely assume it's going to be signed into law. This is a Republican governor. This did pass with a, large majority here. So I expect this to be passed. Now, this obviously will, the biggest impact this is going to have is it's going to increase suicide rates among trans youth, which already is a huge issue. More than half of transgender male teens who participated in the survey, this is a survey done by the American Academy of Pediatrics. So more than half of transgender male teens who participated in the survey reported attempting suicide in their lifetime, while 29.9% of transgender female teens said they attempted suicide. Among non-binary youth, 41.8% of respondents stated that they had attempted suicide at some point in their lives. So this isn't, considering, thinking, thought about suicide. This is actual attempted suicide. More than half of transgender male teens have attempted suicide. That's an insane number. And this is before these sorts of bills have popped up to make it even harder for trans youth to access healthcare. Many transgender young people experience family rejection, bullying, and harassment, or feel unsafe for simply being who they are, all of which can be added risk factors for suicide. And of course, you can add policy to this list. The fact that the entire public right now, in terms of the right wing and the GOP, have spent so much time attacking transgender individuals, transgender youth, and it's disgusting. Now, I want to read through this. So this is a thread that really goes into explaining, because look, if you're not into this in this world, don't understand trans youth healthcare, it's very easy, very reactionary to think, if you're really young, you shouldn't be doing anything with, you shouldn't be engaging or taking puberty blockers, because that's going to impact you, later on in life. Well, as said in the initial report, it is reversible. Puberty blockers are reversible and used all the time, not just with trans youth. So I want to give you more context here so you fully understand what trans youth actually, it entails. So Kentucky here has this great thread. I'll link to it below as well. Says, I cannot stress enough that puberty blockers have been used for decades to delay puberty in cisgender kids who experience precocious early puberty. They are only considered new, dangerous, and experimental when identical drugs are given to trans and gender-expansive kids. I cannot stress enough that puberty blockers are reversible. That's why we've given them to cis kids for decades. It's not HRT. It's not surgery. It's not mutilation. It's not transsexuality. It's just a way to stall when puberty hits before kids are ready. In fact, while I'm here, I'll mention that most medical elements of gender transition were invented for cis people. If you look at the side effects for a bottle of androgel, which is testosterone, they mostly just list stuff about prostates, LOL. It's only scary when trans people do it. Anyway, in legal and legislative sessions, anti-trans adults are making two arguments. One, puberty blockers are irreversible, which is simply false. Puberty is irreversible. People go off puberty blockers all the time. Myth number two, puberty blockers are a gateway drug to transsexuality. Again, cis children and adults use puberty blockers often and stay cis. If a kid goes on HRT after puberty blockers, it's not because of the puberty blockers, it's because they are trans. So it's important to understand, for others to understand who are not trans, who don't know anybody who's trans, who don't follow this. It's important for the average individual to understand what this is all about. This is about limiting the ability for people to be who they want to be, for people to simply live as they want to live. This is I think, a clear human rights violation, and we're going to continue seeing these sorts of bills pop up. This from NBC. This bill is one of two types of legislation being considered in more than 24 states. Measures that ban or restrict access to gender-affirming care for trans minors and those that ban trans young people from competing in school sports teams of their gender identity. Governors in 3 states, Arkansas, Mississippi, and Tennessee, have signed trans athlete bans into law. In addition to Arkansas, Alabama, and Tennessee are also advancing restrictions on gender-affirming care. Alabama's Senate approved a bill that would make it a felony to provide care such as puberty blockers or hormones for trans minors. And a Tennessee House committee also just advanced a similar measure that includes misdemeanor criminal penalties. You have a bunch of people here who don't understand the healthcare aspect of this, don't care, are simply using this as a cultural issue to prop themselves up, to fearmonger, to create more, I guess, support for themselves within the right-wing conservative community who, again, either don't know, don't care, or are just horrible people to support this kind of legislation. Now, I want to leave you here with a resource. So I saw this posted by Hayden here, saying this is a Linktree website I made. It's called transkids.health. You can find organizations that desperately need resources to fight these laws in court, as well as materially providing for these kids through mutual aid. So this is a great site. Again, transkids.health, really easy link. You go there, and you have a bunch of links here. So you can donate to national organizations, see what's happening in specific states, and also donate to who needs help in groups in those states that are fighting these bills. And also, there's also a tracker here, so it tells you, what's happening right now in terms of trans health and LGBTQ rights in general. So, great resource. Again, transkids.health. Check it out if you want to do more.